Good evening, and now we are here as what I promised to you that I will give the uh, answers to our last 2 weeks quizzes. So let's start with activity, elimination, nutrition, and oxygenation. I know it became uh, difficult for you to answer these. So let's take a look. What are the correct answers? So, so the question is, can be dissolved and stored as water in can be dissolved in water as well as stored in the body. So this will be vitamins. This will be vitamins. Approximately, it accounts for 50% of our body components. It will be water. Next is it provide structure with the body and regulates. So it will be fats. Then the source of body protect our organs is also fats. The body's most basic type of fuel and glucose is your carbohydrates. Then prevent problems with movements by adding bulk to feces is fiber. Sorry, protect our organs is our provide structures within the body and regulates processes is minerals. Then protects our organs is uh, fats. Okay, so these are the answers. Then, so there is a scenario here which tells you to arrange in sequence the steps on how you will assist patient during feeding. So in a dinner time at a long care facility and you are assisting Mr. Linkins with his meal, some of the steps that are taken when assisting person with meal are given below. So the correct answer will be 4, 2, 3, 1, 5, 6, 7. So first is you assist Mr. Lincoln's first in toileting. So you will not disturb him if you will pee or poo before eating, while eating. Then next is you check the meal tray to check the patient's identity. Then number 3 is wash Mr. Lincoln's hands and face. Then number 5 is uncover the meal tray. Number 6 is allow Mr. Linkings to assist with the eating process. And number 7 is remove the tray. So that is the answer. Next, a feeding tube that is inserted into the stomach through a surgical incision made in abdomen. The correct answer is gastrostomy. Gastrostomy because the term is stomach, okay, which is gastro, and then ostomy, which means surgical incision. So incision on the stomach is gastrostomy. Many of you have incorrect answers because my instruction is you put a capital letter to all the answers, but you put the small ones. That's why you're incorrect. So compute the total intake of the following. So the correct answer is 610. Okay, so just sum up all the intake, which excludes the urine, urine and vomitus. Okay, because urine and vomitus is only output. Okay, then I repeated it again with the same answer. I made it bonus because I think it is typographically error. What I'm referring here is output, so I made it a bonus for you. So the output here is only the urine via catheter and then vomitus. So it will be 910. 850 plus 60 is 910. Next, giving nutrients through a catheter inserted into a vein is called intravenous therapy and IV therapy. So if you're using a catheter which is inserted into a vein, so intra, okay, venous. So there is a venous, so it means there is a vein. So it will be intravenous therapy or IV therapy. So what is the major risk with tube feedings? Okay, major risk of tube feeding is aspiration, especially if you're using NGT, okay, NGT tube, uh, or OGT, gastric tube. Okay, you have risk of aspiration because maybe the tube will be not will move from the stomach to the lungs. That's why aspiration is the #1 risk for tube feedings. If a person is receiving intermittent feedings, the nurse will, if intermittent feeding, okay, there is a clue here, scheduled feedings. Okay, what you will do? So you will do is give the feeding 4 or more times each day. So you will not attach it to the pump because it will be continuous feeding. Give the feeding over 24 hours, no, because it is intermittent and in scheduled, so it will not be for 24 hours. Then give the feeding directly from refrigerator. It's a no-no because the patient will feel cold if you feel directly. You should warm the feeding before giving to the patient. Okay. So it's very easy for activity. So bending of the body part, it is flexion. Okay. Moving a body part away from the midline, it is abduction. Towards the midline is adduction. Turning the joint upward. Turning the joint upward is turning the joint upward is supination. Excessive straightening of the body is hyperextension. Turning the joint is rotation. Straightening of the body part is extension. Turning the joint downward is pronation, and then turning the joint inward is internal rotation. The patient or resident who cannot get out of bed uses a bedside commode. True or false? So it is who cannot get out of the bed uses a bedside commode. The answer is false. Why? Because if the patient cannot get out of the bed, okay, or he is bedridden, he cannot use the bedside commode because he needs to still he needs to he need to walk to the bedside commode. Okay, what you will do is to put a bedpan or a diaper if you want to pass urine or stool. Assistive devices such as specially made eating utensils help a disabled person again independence, which is important for self-esteem. Assistive device such as specially made eating utensils help a disabled person regain independence. Okay, the answer is true. Okay, if you're allowing a disabled person uh, to do things that he can do, like using the eating utensils, you're allowing him to regain his independence. A bedpan is appropriate when a person cannot get out of bed. True or false? True. Most people consider elimination a very private activity. Yes, it's true. Because anything which shows your private area or genital area, it is a private activity. Then, fill in the blanks using the words given in the brackets. Okay, you will use urination, nocturia, micturition, hematuria, and dysuria. So, a slight red tinge to the urine is called, it is hematuria. Then, it is a need to get up more than once during the night. So, the night, there is a keyword night. So, that is nocturia, because nocturia is urinating frequently during nighttime. Then, a urinary catheter is necessary for the person who is unable to urinate. So the answer is, it's true. Because especially for those patients who have spinal anesthesia and they cannot void because they have effect of spinal anesthesia, their bladder is they cannot control the bladder because their bladder is relaxed because of anesthesia. So they need to have urinary catheter, unless otherwise they will have problem with bladder distension. Which of the following catheters is also known as retention or Foley catheter? So the answer is indwelling catheter. So we need to identify the type of catheter described below. So picture A is called, so you have a straight catheter, you will see a straight catheter. So you will call it as straight. Okay, some of you, they put straight catheter. Catheter is already here. So why you will still need to put straight catheter? Catheter is already here. So it's redundant. So you need to put only straight. Then, and it will be big letters. Identify the type of catheter showed below in picture B. So this is not a straight. There is a indwelling, or there is a two tube or two line. So it will be Foley or retention catheter. Next, picture C. So this is picture C, what you need. So the catheter is open on the suprapubic area, or in your just below the abdomen. Okay, so the answer is suprapubic. Which of the following is a risk factor for constipation? So letters only. So the answer, what are the risk factor of constipation? A, practicing good infection control. It's that the answer. B, exercising daily. Okay, it will not be the risk factor, but it will prevent constipation. Eating little dietary fibers. So maybe this is one answer. Letter D, administering an enema. Enema is allowing you to pass motion. Okay, it's you're instilling fluid to make your patient pass motion. So the risk factor for constipation is letter C. When suctioning is done, make sure suction cycle is no longer than 20 to 10 seconds. Guys, this is false. This is false. Why? The correct answer is it should be 10 and no longer than 10 seconds. 5 to 10 seconds. Next. Is a surgically created opening to the trachea. So opening to the trachea is tracheostomy. Inserting an artificial airway is called an intubation. Intubation. Excuse me. It is a blood in the pleural space. Okay, the blood in pleural space, it is hemothorax. Okay, air in the pleural space is pneumothorax. Next, you are caring for a Mr. R, age 84, who has a chronic obstructive pulmonary disease. So he has an obstruction of the lungs. So answer questions about caring for Mr. R. What position would make it easier for Mr. R to breathe when he is on bed? Of course, we tackled it on module 2. So the position which is indicated for this case is Fowler's position or Fowler's. Then Mr. F is receiving an oxygen through nasal cannula at 2 liters per minute. Her respirations are unlabored at 16 per minute. So it will be normal because the normal is 12 to 20 unless she is walking about or doing personal care. Then her respirations are 28 and dyspneic. Answer questions about her care. Where should you check for signs of irritation from the nasal cannula? Okay, so where you will check if you're putting a nasal cannula because he is dyspneic and he have difficulty breathing, you will check it behind the ears and the nose because you're putting here and here. When the person is receiving TPN, the nursing assistant would assist by providing frequent oral hygiene and other basic needs. When a person is receiving TPN, the total parenteral nutrition, the nursing assistant would assist by providing frequent oral hygiene and basic needs. True or false? It's true. Then, you may change a dressing or peripheral IV on a peripheral IV if the nurse asks you. Okay? If one nurse asks you to change the IV dressing of a patient, okay, don't do that because it's not your responsibility. So the answer is false. When you give catheter care, clean the catheter about how many inches? Okay, so the answer is 4 inches. Next, when you observe stool that is abnormal, report your observations and discard the stool. Answer is false. Why? The report your observation is correct, but discarding the stool is incorrect because when you discard the stool and then you report it to the nurse in charge, how she will verify your observations because you already discarded the stool. So make sure you have a specimen of the stool to show to the nurse. So that's why it's false. Next, bleeding in the stomach and small intestine causes brown to stool to be brown? The answer is false. Okay, it will be false because the color, okay, if the bleeding is from small intestine, then it will be going to large intestine. Okay, it is a long, still a long distance. That's why it will not be brown, but it will be black. Okay, so this is false. Oxygen is carried to different part of the body by the component of the red blood cell, which is called the hemoglobin. When you found a person with difficulty breathing, you will start the oxygen therapy and adjust the flow meter to appropriate amount. Okay, the answer is false. You can start an oxygen therapy, as I've told you, during emergency situations. Okay, but you cannot adjust the flow meter to the appropriate amount. Like, for example, the patient needed 6 liters, okay, you cannot adjust it to the appropriate amount, but you start it in the lowest possible amount that you can do. At least you did something, because actually it's not your responsibility to start oxygen. But there's no harm of doing that. So you start the oxygen, but you start it in the lowest possible amount, which is 2. Medical term for difficulty in labored breathing is dyspnea. So as I've told you, D for D, so this is dyspnea. Adult suction cycles takes only 10 to 5 seconds. 10 to 5 seconds. A suction catheter is inserted not more than 3 times. So if you're suctioning a patient, don't suction for 10 times or for unlimited times, because the patient might have a problem with the tracheostomy, or you will have worsen you will make the condition worse. So please only insert suction catheter only, not more than 3 times. Then deep breathing and coughing exercises help prevent pneumonia and atelectasis. Definitely, it's true. Placing a signal light and toilet tissue within the person's reach provides safety for the person during bowel elimination. It's true. If you brought the patient using commode, bedside wheelchair commode uh, in the washroom, make sure that you give him, or you instructed him, the to call using the signal light. So if he already finished, okay, then he can reach you by this signal lights. A person who must stay in bed most of the time may have irregular elimination and constipation because of poor fluid intake. The answer is false. The person who must stay in bed most of the time may have irregular elimination and constipation because of poor. The reason is not because he has poor fluid intake, but he is immobile, or there is poor mobility. It's not because of the fluid intake, because the patient stay most of the time in the bed. So the answer is false. Then, method of nutrient delivery, wherein nourishment is delivered directly into the bloodstream via a large bore catheter, is called TPN, or total parenteral nutrition. So it's written here abbreviations only. So it will be TPN. So those students who wrote total parenteral nutrition is incorrect. When a person is moving from lying or sitting to a standing position, the blood pressure may decrease. So you have a hint here. It is a 8-letter word. So it will be decrease. Then, which part of the tracheostomy tube is removed from for cleaning a mucus removal? So I told you in my discussion about oxygenation that the part of the tracheostomy tube that needs to be removed is the inner cannula. When you help a person to walk, you should walk to the bad side or weak side or affected side. If you are delegated to give a tube feeding, what should the nurse identify and check first? Okay, most of you, very less of you answer this question. If you are checking, if you're giving tube feeding, especially NGT, okay, as I've told you, you need to check first the placement of the tube, okay, where it is placed. Is it correct in correct location or placement? So how you will check it, you put a, you need to hear the borborygmi sound on the just below the chest bone, okay, using the stethoscope and uh, using the syringe. Then list the amount of ml in the following. So you should, as I've told you, you should memorize this one. 1 teaspoon equals to 5 ml. Those who put 5 ml is incorrect because you have already ml here. Why you need to put ml, still ml? So it will be only 5. Then 1 pint equals about 500 ml. And 1 quart equals about 1000 ml. So these are the answers in our exams for activity, elimination, nutrition, and oxygenation. Okay, actually, most of you got the answer, but they did not follow the instructions. That's why I made it incorrect because they are not following. If it's capital letter, it will be capital letter. It will be, if it will be a single word, it will be single word because like here you have already the ml, why you need to put another ml again, so it will be incorrect. So let us always follow directions. It's very important. Next one, care of surgical patient, mother, pediatric, and elderly. So it will be more easy than the last topic that I've discussed. So it's very easy. If you know what is the part of first part, what is the part of the body systems, then you will got it correct. So match physical changes during the aging process with the body systems affected. For these are the stages, aging process or the changes that was encountered by elderly patients. So artery, narrow and less elastic, of course, circulatory. Reduced blood flow to the kidneys, of course, urinary. Forgetfulness is nervous system because it's about brain. Gradual loss of height, it will be musculoskeletal because the vertebral column is decreasing. That's why it will be loss of height. Decreased strength of coughing, it's respiratory. Secretions and oil sweat glands, it will be integumentary. Difficulty digesting fried and fatty foods, it will be digestive. Then heart pumps with less force, it will be circulatory. Bladder muscles weakens, it will be urinary. And difficulty seeing green and blue, it will be uh, see difficulty seeing green and blue, it will be nervous because it's connected with our brain, and you don't have options here of eyes and ears, so the next option will be nervous. Then difficulty swallowing, it will be digestive. Lung tissue less elastic, it will be respiratory. Bone mass decreases, it will be musculoskeletal. Then testosterone level decreases, so this will be reproductive. And facial hair, in some women it will be reproductive. It will not be integumentary. Why? Because it will be caused by a hormonal change in reproductive organ. That's why the facial hair in some women is changing also. That's why it will be reproductive. When bathing an older person, what kind of soap should be used? Okay, the correct answer is mild. So it will be mild soap, hypoallergenic soap, it will be correct. Why? Because we older patients, we cannot use those strong soaps that we are using because their skin are easy to be irritated. That's why we are only using mild soap. Then, when bone mass decreases, why it is important to turn an older person carefully? When the bone mass decreases, why it is important? Of course, to prevent pressure ulcer. Why does an older person often have gradual loss of height? It's because the vertebra is having a decrease. Your vertebra or your back, okay, it is decreasing because it's curving. Okay, that's why you have a loss of height. Then, what type of exercise help prevent bone loss and loss of muscle strength? Okay, so as what I've told you, range of motion exercises is very helpful, and also brisk walking is very helpful for your patient. Older people have changes in nervous system. When the changes listed below happen, what physical problems occur? Okay. If there is a problem in nervous system, what will physical problems? Most of them, they have dementia, they have forgetfulness, confusion, because their brain cells shrinks. Okay. When you get older, your brain cells shrinks. That's why you have this dementia, Alzheimer's, or confusion. So this will be the answer. How can you help circulation of persons confined to bed? Okay, you can do bed turning every 2 hours, or moving the patient, allowing the patient to move, then put a anti-embolic socks. So these are the things that we can do. What can the nursing assistant do to prevent respiratory complications? First is you instruct deep breathing exercises. You can instruct to use intensive inspirometry and turn the patient regularly or move the patient regularly. The stomach and the colon empty slower, and flatulence and constipation are common in older person. What are these causes? The causes is because the peristalsis of the elder people is slower compared to the normal people because they have less mobility. They are uh, less active. That's why they have flatulence and constipation. How does good oral hygiene and denture care improve food intake? How does good oral hygiene and denture care improve food intake? Of course, it will enhance the appetite, or it will improve the appetite. If you have a clean oral cavity, you will have a uh, increased appetite. So this is very easy. I don't know why you did not get it. You just identify the preoperative phase, the postoperative phase, the intraoperative phase, and the perioperative phase. As I've told you, preoperative is those activities that you're doing for patients before operation. Postoperative are those activities you're doing after operation. Intraoperative are those activities you're doing during operation, and perioperative are those activities you're doing for the three phases mentioned above. Okay, then the instruction is you choose a letter only, not the whole answer. So that's why others who got correct answer is wrong, because they did not follow the uh, instruction to put only the letter. So the question is, during the blank, the person is prepared physically and emotionally for the surgery. So the answer is preoperative. Okay, the patient cannot be prepared after operation because it should be prepared before operation, so will not have anxiety. Then, during the blank, the surgery is performed. So during, so it will be intraoperative. So the answer is letter C. Then, during the blank, the person recovers under the watchful eye of the healthcare. Recovers. It means the operation finished already. So the answer is post-operative. Then, these phases together, okay, so all the three phases that I've mentioned, as I've told you, this is perioperative. So the answer is letter D. Why is a person who is scheduled for surgery placed on NPO status for 6 to 8 hours before surgery? List two things a nursing assistant can do to help make being on NPO status easier for the patient. Okay, only two students, I think, got the answer correct. Okay, the reason why are you putting your patient NPO status, because you are preventing aspiration. Because when your patient was given an anesthesia, okay, uh, if he or she ate, the problem, he will aspirate all of this food, okay, to his lungs. So to prevent the aspiration to happen, you should NPO or place NPO status to patient for 6 to 8 hours to prevent aspiration. So how you will make things easier so the patient will follow you. Of course, you need to educate the patient by giving uh, at 12 a.m., ma'am and sir, okay, you are not required to eat food or any oral intake because a uh, you might have an aspiration. So if you told that if you explain to the patient well, okay, they will understand, and if they know the consequence of having oral intake, okay, they will follow you. So that is the answer. List two precautions that are taken after a patient is given sedative and reason why these precautions are taken. So also this one, very less students got the answer. So if you're given the patient sedative is the anesthesia. Of course, if your patient is sedated by the anesthesia, two precautions that we are observing is fall precaution. Of course, if you have this anesthesia, you can become dizzy and you will fall. Okay, then you can also, one precaution also is your positions. Okay, if you suddenly change your position, you will become dizzy or you will collapse, especially if you got general anesthesia. You will collapse if you do not maintain on bed for 4 to 6 hours. So that is the precautions who receive, for those patients who receive sedatives. What are the duties of the nursing assistant while the person is in surgery? For preparing the person's room, it's very easy. So what you need to do is to prepare surgical bed, as what I've told you before, and you prepare emesis basin. Okay, why kidney basin? Because the patient might vomit, or that are the things that we can do or we can prepare when the patient arrives. Vital signs machine to check for the vitals. For post-operatively, what is the schedule for taking vital signs? As I've told you before, during the vital signs discussion, I told you already, other students got this correct. Okay, at the first hour, when your patient came, okay, you need to check vital signs 15 every 15 minutes for 4 times. So every 15 minutes for 4 times, then every 30 minutes for 2 times, then every 1 hour for 2 times, then every 2 hours for 2 times, and then every 4 hours. Okay, so that will be the schedule of taking vital signs for patients who is post-operative. Why you're checking post-operative the vital signs? Because the patient might have a complications related to surgery. So you need to check it to monitor it strictly. Look at the figure below. What respiratory exercise is that patient doing? Okay, and what complication does this exercise help to prevent? What she is doing is deep breathing and coughing exercises. Okay, so he will cough using, he will press here in the abdomen using an pillow, okay, to expand the lungs. Okay, what complications is preventing is lung collapse or atelectasis. Anesthesia agents, pain medications, and immobility after surgery can cause the body's circulation to slow down, putting a person at risk for thrombus formation. So list 3 things that could happen if a person develops thrombus. So what are those? He can have stroke, he can have myocardial infarction, he can have DVT, he can have pulmonary embolism. So these are the things. Then list 3 things that are done to help lower the respiratory person's risk of thrombus formation. And what are the interventions? We can put anti-embolic stockings. We can turn the patient side to side. We can do incentive spirometry, and we can do deep breathing exercises, and then range of motion exercises. So write down the nursing assistant responsibilities with regards to each of the following during the post-operative period. So while assisting with positioning, okay, what we can do if your patient is spinal anesthesia, we position our patient flat on bed for 24 hours to prevent spinal headache. If your patient is having general anesthesia, okay, allow your patient to stay on bed rest 4 to 6 hours, because he might collapse if he will mobilize or feel dizzy. Then, assisting with nutrition during post-operative, if your patient is having general anesthesia, don't feed the patient 4 to 8 hours post-operative because he might vomit. Assisting during elimination, during post-operative period, okay, you assist patient, give bedpan or urinal because if the patient have spinal anesthesia, he cannot go out of bed. Also, general anesthesia, he cannot go out of bed for 4 to 6 hours. So you assist with the elimination needs. Then, very easy this question. If you listen to my uh, video, okay, you will answer these questions. These 4 general responsibilities a nursing assistant has when caring for a woman who has just delivered a baby. So it's very easy. I think you answered all of this. Okay, you monitor the vital signs, you assist perineal care, assist the baby. So these are the things. Briefly answer the following question in space provided for each of the scenarios below. What are your role in assisting new mother with feeding with infant, breastfeeding baby boy? So make sure that the patient is effectively breastfeeding. Make sure that he has a good suck to the breast of the mother and assist them into comfortable position. What is the correct position in breastfeeding? Then, what is your role during commercial formula or bottle feeding? Of course, you discourage the mother to do bottle feeding because bottle feeding has very less nutrients compared to breastfeeding. But if you're the mother, have difficulty or breastfeeding, the doctor will advise him or her to use bottle feeding. So what is your role during this time is to make sure that the patient's or the baby's position is correct. Okay, so he will not aspirate the formula and make sure the ratio of the formula and water is correct, which is 1:2. Then make sure that it's not propping the baby, like is putting a pillow just to hold the bottle. Make sure that uh, the position of the bottle for feeding is correct. Then safety precautions when caring for infants are given below. So never leave. So under each precaution, write the reason. So we are only searching the reason. Never leave an infant on a surface unattended, even for a moment. What is the reason? Because he might fall. That's very easy. Next, what is the reason why you do not leave an infant unattended, even in a water? Of course, he may drown. Then, number 3, make sure that the electrical cords and window blind cords are out of reach of the infant. Why? Because he might strangle himself. Briefly answer the following question in the space provided. How can you promote a toddler's independence? Of course, independence, the toddler is independent because they are in autonomy versus shame and doubt. So it means that they want to decide for their own. So to let them do it independently, okay, let them dress themselves while you are there. Karen is a 5-year-old boy who is about to have a very painful diagnostic procedure. She asks you if the procedure is going to hurt. What will you tell her and why? Okay, what will you tell her? As I've discussed to you before, what you will tell is, okay, you get something as a representative. Okay, if there will be an injection, you get a syringe toy. Okay, then you inject it first to you, then you will tell it will hurt little, then you tell to the uh then or you it will not hurt you. so the patient will not be anxious. So that's the way you will help the patient, a 5-year-old patient, to be less anxious. How can you help meet the emotional needs of the school-age child in a healthcare facility? School-age children, that's why they are called school-age, okay? If they are in the hospital, okay, you can help them by giving them any materials that is related to school, okay? So if you have answers like this related to school, you will be correct. Next, Mandy is a 15-year-old who is receiving care following a skiing accident that resulted in several broken bones. She needs a great deal of assistance with her activities of ADLs, including bathing and elimination. Most of your interactions with Mandy have been unpleasant. She is sarcastic and sullen. Why might Mandy be acting this way? What can you do to help make her time in the hospital easier for her? Okay, so let's see. Mandy is a 15-year-old. Okay, means Mandy is adolescent. Adolescent psychosocial stage is identity versus role confusion. Okay, so at this time, you will notice that the adolescent, they are very particular with their privacy. Okay, so make sure that you're promoting privacy for this patient because it's very sure that you will have unpleasant encounter to her. She will not promote privacy because she is already a an adolescent. Okay, so make sure you promote privacy. So that is the answer for this. Then the last one is give the signs of abuse in child and your nursing assistant role in reporting suspected abuse. So I told you what are the signs of abuse. We have the physical, okay? You will see the patient have bruises, the patient looks untidy, emotionally abuse. You will see the patient is very depressed, the patient is not talking to you, okay? So that is the sign the patient is abused. What are your role as nursing assistant? Of course, you report this to your in charge. So these are the answers for the last two quizzes. I hope you got the answers. Thank you.